Hey guys, so in this video, I wanted to address a post that I saw on Reddit, and I thought it might be helpful to some of you who are interested in maybe pursuing medical assisting or are interested in medical assisting, because that's what the post has to do with. So this person says, looking to pursue a career as a medical assistant. However, I just found out that MAs are taught to take blood. I live in Washington State, where it's required that you have a phlebotomist certification to draw blood alone, but apparently you can still draw blood as an MA sometimes if a doctor needs you to. I suspect that won't happen much, but the issue is I can't even get my own blood drawn without throwing up, having an anxiety attack, or passing out. I really won't know until I try, I guess. However, I don't want to spend thousands on classes to find out that I can't do it. It's not the blood for me, it's the sensation of the needle going into my vein. Anyone out there have a similar experience? Fear of blood draws, but able to take blood from others. So I will tell you, as someone who has gone through both phlebotomy and medical assistant training, there were multiple people in my phlebotomist training class who had an issue with blood when they were getting blood drawn themselves, but it's totally different when you're drawing someone else's blood. And if, as you say, it's the part that bothers you is like the sensation of the needle going into your vein, that bothers you, I don't think that you would necessarily have an issue. However, if it's something where the sight of blood causes an issue for you, you may want to reconsider some things. And I only say that because with phlebotomy, especially if you're going to work in an area where you are required to draw blood a lot, blood is something that you are going to have to become comfortable with. And if you can't get past that fear of like the sight of blood, obviously I know that this person was talking more about the sensation being a bother to them. But if you are a person who the sight of blood bothers you, you're either going to have to overcome that fear really fast, or you may have some issues like working in an area where phlebotomy is something that you do on a frequent basis. Now, I will tell you that in my current medical assistant job, we actually send all of our patients to the lab, because I work in the hospital and our patients are sent to the lab for all of their blood draws and things like that. We do run like point of care testing. We may do like finger sticks for blood sugar, or the waved testing type stuff, but like regular blood draws, all of that is done in our lab. So I count myself very lucky that I don't necessarily have to do that, even though I am a certified phlebotomist. I have been since 2019. It's just, I don't necessarily have to use that portion of my training in my everyday job. However, I do have other responsibilities. I also think that as a medical assistant, if the sight of blood is something that bothers you, you may want to reconsider, because there will be times where you would have to help the provider with wounds. You may have to help with stitches, staples, different office procedures that you might be exposed to different bodily fluids, whether that is vaginal secretions, mucus, blood, vomit, urine, all kinds of different things you may come into contact with on a daily basis, depending on what specialty and what type of procedures your provider actually does in office. So I think it's definitely important to make sure that you desensitize yourself at the very least, or get used to the fact that you may need to consider something else. I do think that, like I said, there were a lot of people in my phlebotomy training class that were not necessarily comfortable with getting their own blood drawn, but they were completely fine when doing it on somebody else. I think that it's kind of weird in a way that like the fear of having it done to yourself is kind of negated by you doing it to someone else. But I never really had a problem with it. sometimes, like, if I'm not feeling well and I have to get my blood drawn, I will just, hand my arm and I will look the other way. Just because if I'm already not feeling well, I feel like that predisposes me to maybe be a little bit more sensitive than I normally am, if that makes sense. And so, like, I feel like it's important for me to just maybe minimize the risk of that even happening in the first place. So that's why I will turn my head away so that I'm not making eye contact with them drawing the blood from my arm, or wherever they're drawing blood from. Because basically, what I do, since I tend to be a hard stick sometimes, I just kind of say, here, or if they ask me what arm should I go with, I'll just say, wherever you can get blood from is where, you can take blood from. So I think it's important that you learn to overcome those things. So I will also say that phlebotomy training is an aspect of a medical assistant program. At least it was part of mine. It was part of other people's programs that I know of that are medical assistants. And it's just a procedure that you might need to know. Sometimes our satellite clinics at the hospital I work at, our satellite clinics, they do draw blood at the satellite clinics, but not at our main hospital location, because we can just send them down the hallway to get their blood drawn in the lab that we have at the hospital. Or they can, go back to work and come back to the outpatient lab to get their lab draws done whenever they have the time to do so. Although obviously we would prefer them to do it before they leave the building, since sometimes people just they don't remember to come back to get those done, and then we're waiting for test results that never come, which could affect a lot of different things. Like, it could affect medications and stuff like that. Like, there's a lot of different factors. So anyways, hopefully that was helpful. I know I kind of got a little bit off track there at some points, but yeah, I hope that was helpful. Anyways, if you guys have any medical related questions, whether that's CNA, phlebotomist, or medical assistant, or pre-med, let me know. I'd be glad to answer them. If you have any other questions or topics you'd like me to discuss on my channel in the future, please be sure to let me know. I'd be glad to get something filmed for you. And with that being said, I will talk to you guys next time.